Welcome back to the show. Joining us now to discuss sex and relationships is sexologist Dr. Limor. Blockman, thank you so much for being here.
It's my pleasure.
So fun to say, sexologist. I mean, that must be an
know.
amazing title to have. But we are going to talk about a really serious issue today, and that is IVF affecting couples in the bedroom.
Right, libido. We all think about, you know, the whole, do you have kids?
I have a baby.
Yeah, so you know, yeah, it's wonderful. But struggling to have kids and, you know, the whole thing, sex for procreation has been, you know, possessing the humankind since the dawn of time.
Right.
So we've been dealing with it, and I just want to say that we're going to get into it, but I just want to give some definitions for our viewers to just understand what it involves, you know, what it really revolves. So infertility, what does it mean? So if you try for 12 months to conceive and you don't succeed, that will apply as infertility.
Okay.
Yes, and a few methods could be applied to treat that. One of which is IVF, in vitro fertilization, and just you take a sperm, you take an egg, you fertilize them out of the womb and return them into the womb for a prospective, you know, healthy pregnancy.
Right.
By the way, in vitro from Latin is in glass, little glass babies.
Oh, really? I didn't know that.
Yes.
You learn something new every day.
Yeah, you see. So before we're going to show a little video clip, I want to give you a few facts about in vitro. So first, I really want to say that 5 million pregnancies, successful pregnancies, have been the result of IVF since it started in the late 70s.
That's wonderful news.
Yeah, and half of these, 2.5 million, have been in the last decade. So that's really a great success, and you know, it's been going on and it's been achieving great success and great happiness for many couples.
It's become really the norm for couples who suffer from infertility.
Right, exactly. And you know, if you are 35 years old and under, you have 40% success with this, with IVF, which is very big and very, you know, something that it's kind of your go-to thing if you were struggling and you have issues. Something important that I found about IVF is that most health insurance coverage is not really covering IVF in the United States, but it does cover vasectomy.
Really?
Matter.
Okay, let's talk about double standards.
Yes.
But here in Israel, I mean, the health insurance is socialized, and
yes, and
you
it
have
covers. We're one of the leading countries, and that brings me to the next point that I wanted to make about the destinations that are very successful in terms of where do you go to get IVF. So there's Spain for the health insurance that is very accessible. There's India for the vast, you know, spectrum of facilities and low rates and everything. Ukraine, for that matter, is one of the leading places to get IVF because they apply surrogacy. So you can take a womb, you can take sperm, you can take an egg, and actually host that pregnancy. And they had a very advanced breakthrough recently that they call a three-way IVF. It sounds much sexier than it is.
It's really just in a petri dish,
yes,
right?
Well, yeah, they take, you know, genetics from the parents and then they apply it to an additional egg of a donor. And that, you know, that kind of combats any kind of risk for genetic disorders or things like that. But last and not least, we have Brazil, which is renowned as a medical tourism destination. In other words,
more so for plastic surgery.
Yes, get your baby bump and your Brazilian butt at the same price. So,
oh my God.
Yeah. So we can see that video clip and continue speaking.
Let's have a look.
Yeah.
Hey.
Hey, honey. Robin Leach says we should move to Antigua.
Oh, yeah. Come on, hurry up. Snap to I'm ovulating.
I'm in the middle of important show research.
Howard. Seriously, come on.
You know what? You're getting baby fever here, and you know, maybe it's a little premature. I'm about 3 days away from being fired, the way I figure it. And you want to know something? You got to think about the economics of this.
You're the best morning man in the history of radio. Any minute you're going to be number one.
Is that so?
Yeah,
Let
strip.
me tell you something. Look at yourself. You're completely on fire about having a baby. You don't understand. I'm not a piece of meat. I mean, I have to be romance.
Yeah, please.
Okay, so there is really a lot of reality here in this. A lot of couples go through this. And, you know, what's your advice to couples who find themselves just going through that routine?
So,
sex becomes only about conceiving.
It's very difficult. And I just want to say, just for the sake of it, that it's very true. When Howard Stern is saying it, it seems very funny and very hilarious and everything. But really, 60% of women that went through IVF said that they had difficulty, pain during intercourse. mood swings, disinterest in sex, and men, you know, on their side, actually like very much like men that gain weight while their wives are pregnant. A lot of men testify to have ED, which was, you know, erectile dysfunction, which was the result of lack of spontaneity, and, you know, he needs to be romanced, the whole thing.
Yeah.
So what do I suggest? I suggest really taking it slow, remembering that the ride is at least as important as the end goal, and keeping in mind that once we have this baby, it's not going to be that steamy in the bedroom for at least a few months to a few years. So be recreational now, and most importantly, I know the commandment was, you know, be fruitful and multiply, but I say be playful and multi-climax. It's much more interesting.
Well, you know, I would say you never know how people are after the baby, though.
Definitely.
You never know.
And
it's
also,
a good goal to have in mind, right?
Absolutely. And also just keep in mind that spontaneous pregnancy happens in 60% of couples that exhaust IVF.
Wow. Wow.
Yes.
Well, that's good news.
Yes.
Dr. Limor, thank you so much for being here.
Thank you. My pleasure.